So emergently, we wanted to treat this cardiac arrhythmia in this patient with severe azotemia because, we wanted to stabilize her, right? So what are our options for treatment? So the first option would be to consider diluting the potassium. So just through administration of IV fluid. So that is definitely one option. And we have probably several indications to go ahead and do that in Indiana, given that she was hypotensive and hemoconcentrated. So that's a reasonable option for treatment. The next option that we have would be to consider antagonizing the effects that potassium has on the cardiac rhythm. So this we do through the administration of calcium gluconate. And just to remind you of how calcium gluconate works, so calcium is going to reestablish the difference between the resting membrane potential and the threshold potential, which will allow the sodium channels to be reactivated and allow the action potential to develop. So the kind of nice thing about using calcium gluconate to treat arrhythmias associated with potassium is that administering calcium will have an effect on the cardiac arrhythmia within minutes of administration. So while you're giving the calcium, typically you can already start to see an improvement in the cardiac arrhythmias. And then the final option to treat the hyperkalemia that we were seeing in Indiana would be to consider pushing the potassium intracellularly or causing translocation of the potassium from the intravascular space into the intracellular space. So we have a couple of medication options to consider. The first would be to administer regular insulin combined with 50% dextrose diluted. Usually we're giving 0.5 gram per kg diluted. Or we could consider administering a beta agonist like Terbutaline. You could consider albuterol that's inhaled. So basically, both of these medications have a similar downward effect in that beta stimulation, as well as insulin, is going to activate the sodium-potassium ATPase pumps that will lead to potassium influx into the cells. This is going to take a little bit longer to have an effect as compared to calcium. So probably maybe takes about 30 minutes or so to cause the translocation of potassium to the intracellular space. But based on what we know from people, we could expect that using one of these medications would likely decrease the potassium by about 1 milliequivalent per liter, which is pretty effective. So we may be able to take a patient from a potassium of 9 to a potassium of 7. And that would just be with that one treatment alone.